Hi, welcome back to the Gluten Free RN podcast. I'm Nadine Gross-Kowiak, the Gluten Free RN. Today, during episode 35, we're going to talk about men and celiac disease. And we're going to include non-celiac gluten sensitivity in this talk today. Stay tuned. As I said, there's a lot of information to talk about. Hi, and welcome back to the Gluten Free RN. Today, during episode 35, we're going to talk about men and celiac disease. This is a really important topic, and one that I don't hear discussed or talked about very frequently. Many times, people think it's only women that have celiac disease because we're the weaker sex, of course. I would debate that highly, but it is considered that men are much less likely to have celiac disease or non-celiac gluten sensitivity, mostly because they're manly men, and manly men can eat and drink everything, right? Well, come to find out, celiac disease is found typically in a ratio of 1-to-1, which means that for every woman that has celiac disease, there's another man out there. And typically, the ratio for diagnosis is 3-to-1, which means for every 3 women that are diagnosed with celiac disease, there's 1 man. So you can begin to see why there are many, many more men that are undiagnosed. Keeping in mind that celiac disease happens at this point in history, at least in a rate of 1 in 100. However, less than 1% of 1% are actually diagnosed in the United States. If you hear a rate that's higher, that's pretty optimistic, based on what I see and hear every day. However, there is hope in the fact that at least 33% of Americans and Canadians are on a gluten-free diet. And that's without a diagnosis. And if you live in the United States, and as I'm finding out in Canada, it is difficult to get tested and or a diagnosis for celiac disease. So many people are changing their diet, either because they want to feel better, they've heard it could make them feel better, or a family member has been diagnosed with non-celiac gluten sensitivity or celiac disease. And because celiac disease is genetic, it makes sense for the entire family to go gluten-free. And I do mean whether you're related genetically or not. Since we're talking about men, and when I started this 11 years ago, I had a little joke that I told, or at that point, I like to consider it a truism. I would say it's harder for men to change their underwear than to change their diet or lifestyle. And that was based at the time on firsthand experience. I no longer say that as much because I've seen some men who basically come into my office and say, you know what, I just want to feel better. You tell me what to do, and I will 100% do it. I'm not messing around anymore. I am tired of having all these symptoms or this diagnosis that doesn't make any sense. So you tell me what to do, and I will do it. And they do. So I have a lot more admiration for the men who just pretty much buck up and change their diet, change their lifestyle, and end up feeling better. They look better. Several of the men that I work with now have abs that they never had before. And trust me, abs are like the trophy. So it's interesting to keep in mind, in episode 34, I talked about the fact that gluten is addictive. It is addictive. It has a morphine-like effect on our brain. So many of the men I do talk to about going on a gluten-free diet will say, well, I could never do it. I'm addicted to my pizza and beer, or I will never give up my carbs. I'm a carbaholic. Well, that's the gluteomorphin effect on their brains, and it does make them more resistant to changing their diet or considering it because of that addictive-like quality that gluten has on our brains. And it's not just the gluten, it's the dairy and the sugar also. So I've been told by a few people that they like the stories. So I'm going to tell the story of a person that is in my direct circle of friends, and he came to me and he was actually in my house. We were talking about doing some remodeling, and he told me a story of him being in the hospital because he ended up getting diagnosed with pancreatitis. And he is a gentleman that is in his 40s. And I said, "Are you an alcoholic? Do you actually drink a lot?" Because I wouldn't suspect that based on a number of other lifestyle choices. He was athletic and very busy and owned his own business. And he said, "No, I drink socially, but I don't drink a lot." And I said, "Well, did they figure out why you have pancreatitis?" And he said, "No." And I said, "Well, you go back to your doctor and you tell them that you want to be tested for celiac disease." So he did. He actually went back, got tested for celiac disease, came back positive, and number one, no longer has pancreatitis and is not worried about having pancreatitis. But he feels better. He almost immediately stopped clearing his throat once he changed his diet and felt better overall, didn't have fatigue. And that inflammation of the pancreas is something that I have an enormous respect for. So the pancreas is a very important organ. And at some point we'll do an episode in the future on pancreatitis, and we'll talk about everything to do with the pancreas. But because I have a deep respect for the pancreas, I'm so happy that he actually got a diagnosis of celiac disease so he doesn't have to face future episodes of pancreatitis, hopefully, because it can be fatal and it can cause many other health issues. So how does celiac disease show up in men? Well, very much the same way it shows up in women for the most part. It can be fatigue, thyroid issues, anemia, osteoporosis or brittle bones, bowel issues, difficulty swallowing, chronic cough, GERD, gastritis, hemorrhoids, gas, bloating, diarrhea and or constipation, irritability, IBS, urinary incontinence or BPH, which is benign prostatic hyperplasia, which is a non-cancerous enlargement of the prostate gland, but it obstructs the urinary flow. Erectile dysfunction, which, believe it or not, is hypoxia, which is decreased blood flow, thereby decreased oxygen flow. Prostatitis, prostate cancer, facial tics. I'm just naming some of the things that men have presented with in my office during consultations. So I see men presenting with very similar signs and symptoms that women present with, but of course they have their own set of signs or symptoms that are troubling or problematic for them as men. Unfortunately, men typically will say, "It's not me. It can't be me. I can't have celiac disease. I would have to change." Well, change can be good, and we all as human beings do have to be a little bit willing to change for our health. And I see a lot of men at gyms and exercising. They run, they do many different things for their health, but very few of them will actually look at their diet. Well, if you're exercising and you want to be healthy, you absolutely have to look at your diet. The other thing I wanted to mention is that if you're a man and you have osteoporosis and anemia, which is a low H&H or a low hemoglobin and hematocrit, then you have celiac disease until proven otherwise. So someone should be reviewing your lab and making sure that you have enough red blood cells and that the hemoglobin and the hematocrit are in the normal range. Another story of a very sweet man is that when I met him, he had a climbing PSA, which is the lab indicator for prostate cancer. And please keep in mind that he is in his late 40s at this point, so he's pretty young, but his dad did die of prostate cancer. So at a young age, they started checking his PSA, and it was climbing, getting higher every time. He was having difficulty sleeping, snoring, and he had to have some type of bread or cereal or something before he drank coffee. Otherwise, he would be bent over with cramps from his abdominal pain. He was chronically belching, so he had a lot of gas. And his fingernails and toenails were pretty brittle and had lots of ridges on them. So this particular man ended up on a variation of a paleo diet, and his PSA went down to normal limits, which if you ask most urologists, they'll tell you that never happens. But here's the case where a strict paleo diet over a period of time actually lowered a PSA level. He sleeps better, no longer snores, is able to drink coffee without eating anything first, so that gastritis is gone or that inflammation of the stomach lining, and he no longer belches. Oh, okay, sometimes he belches, but not very often. And his fingernails and toenails are much healthier and stronger, and they're not brittle, so they don't break as often. And you would think that wouldn't be such a guy thing, but it is very important, and it is an indicator of malnutrition or nutritional deficiencies. If you've read my book, Donation, you will have read the story of me getting diagnosed with pneumonia way before I got diagnosed with celiac disease when I was 36. And the doctor that I used to work with actually diagnosed me with that pneumonia. And he prescribed me with Levaquin, which is a very potent fluoroquinolone antibiotic, which I no longer recommend that people take for a number of reasons. Anyway, fast forward to a couple of years, and I've been the Gluten Free RN at this point for 10 years, and I get a call from this doctor that diagnosed me with pneumonia, a good friend. And prior to this, he had always referred to me as the gluten insufficiency nurse, which he thought was really funny. And of course, laughed very profusely at himself about coming up with that. So he would introduce me to other people as the gluten insufficiency nurse, as if I didn't have enough gluten. So he calls me one day out of the blue and he says, Nadine, I need to buy another copy of your book and I need to come in for a consultation. And I thought, that's really funny. Thank you very much for calling. And he said, no, I'm not kidding. And I said, why? What's up? And he said, well, I was reading back on my report from 7 years ago after my endoscopy, and it basically says that I have celiac disease. I said, what? And he said, yes. They told me that it might be better if I go on a gluten-free diet or a wheat-free diet, but I didn't have to. That it might help, but they doubted it. But now that I'm reading it and reading some more information on celiac disease, I think I have it. And lo and behold, the doctor that I worked with that had referred to me as the gluten insufficiency nurse actually has celiac disease himself. And he himself feels much better. He wrote a letter to his doctor and said, hey, why didn't you diagnose me with this in the beginning when I showed up with a positive endoscopy for celiac disease? And he also wrote another letter and said, all of my symptoms that you've been treating me for years have gone away. I no longer need my Cialis, which, by the way, is very expensive, and I feel better than I've ever felt. And he actually encouraged his doctor to test everyone for celiac disease. I do work with a lot of healthcare providers, including doctors and physician's assistants, nurse practitioners. They end up coming to see me because their practitioners don't really know a lot about non-celiac gluten sensitivity or celiac disease proper. I am very happy that they have me as a resource. Some of their stories as medical providers are not that different from the people that come in from the lay population. Some of them are worse. So I'm very happy that they have a resource that's local and that I can help them. One of my other friends who is my age, and his story is actually in my book, Donation. He's a physician's assistant, and he had been diagnosed with atypical Crohn's disease. He ended up in the emergency department 3 times with rectal bleeding or GI bleeding, bright red blood from his rectum. And so he went in to be seen and they diagnosed him with atypical Crohn's disease. And they resected his bowels, which means they took part of his intestines out and rehooked it up again. They told him he'd always have Crohn's disease and that he wouldn't get better, and there were no diet changes that would help him. He was just going to have to take medications for the rest of his life. Doug knows what I do, and so he came in to see me, and I told him exactly what to do, and he followed my instructions exactly because he wanted to get better. And lo and behold, he did. He no longer has Crohn's disease. He doesn't have rectal bleeding, and he's one of the guys that I work with that actually has a nice set of abs. So his abdominal muscles are prominent. Like I said, he's my age, so he's about in his late 40s, 50s, and he feels enormously better. And that is what this is all about. If you want to feel better, if you don't want to be fatigued or have the risk of bowel cancer or prostate cancer, and you want to minimize your risk for all types of health issues, changing your diet can be a very effective way of doing that. A lot of the guys I see, and quite frankly, a lot of the women too, will complain of having a lot of gas. They smell bad, they belch, it's embarrassing, they, have explosive diarrhea, or they're in the bathroom all the time because they have constipation. Constipation, by the way, is a neurological issue. It's not necessarily a lack of fiber and water. If you're eating gluten and you have constipation, please keep in mind that if your enteric nervous system is affected by the gluten can actually cause paralysis of your intestines, which means that the peristalsis that should be occurring and helping to push all of the food that you eat that becomes stool through so that you can poop effectively, typically once, at the very most twice a day, it doesn't happen. So you end up with paralysis of your intestines, which is the constipation. So many people that have had constipation that go gluten-free or paleo end up with normal bowel movements. And unfortunately, a lot of people don't even know what a normal bowel movement is because their bowel movements have always been that way, or they've just learned to deal with whatever is happening. And when I interview people and I ask them what their family history is, usually the men will say that their father or grandfather died early from some type of bowel cancer or rectal cancer or esophageal cancer, or they had a stroke or a heart attack at a young age, and they suffered symptoms for years. And a lot of men that I see in my office don't want to suffer like that, and they don't want to die early. These men are tired of suffering needlessly, but they do need answers, and they're not getting them from their doctors or their healthcare provider, from the media, or from anywhere else. A gluten-free diet is a viable option. And I do encourage people to consider taking up a paleo diet or some type of whole food diet. And what that means is really good grass-fed, no antibiotic, no hormone meat, fish and eggs, fruits and vegetables, nuts and seeds. That doesn't sound like a lot of food, but trust me, it's an enormous amount of food. So basically, you're removing all grains, including rice and corn, all legumes, which includes peanuts and beans, and then processed foods. Keeping in mind that on a paleo diet or a gluten-free diet, gluten-free and dairy-free hopefully, that you have to eat a super good high-fat diet, which includes bacon. And don't just cook up the bacon. Use the bacon fat when you're sauteing your greens, such as chard or kale, broccolini, Brussels sprouts. Everything is better with bacon fat. So use it because your body can actually utilize that fat. And it needs that fat to heal. And it also needs that fat to keep your brain healthy and your nervous system healthy, to prevent things like ALS, Parkinson's disease, MS, and any other neurological disease or syndrome. I really do want to work with men, women, and families that want to get better, not just for themselves, but for future generations. But if you like the way that your life and your health are playing out, that's fine. It's all okay. But I do want to find those people that want to get better, that are frustrated, that are not getting the right answers from their healthcare providers, and they are searching for that missing link, the thing that is preventing them from getting better, the thing that is allowing their bodies to fall apart, which our bodies are not supposed to fall apart. We're not supposed to get fat and painful and crotchety and immobile. We're supposed to stay active and happy and enjoy life for as long as possible. At some point, we're all going to die, and I'm okay with that. We all have to decide if it's worth it to us to feel better or just allow our bodies to fall apart and disintegrate. And I do ask men all the time, why is it that men are more resistant? Why are they less likely to change their diet? What makes it so hard? Or what makes it easier? Some of the answers are that if you already like fresh food, then it's much easier, and it helps if someone is cooking for you. But I encourage men to actually at least come up with a few recipes, number one, that they really like, that are easy to prepare, and that they don't mind eating sometimes, once a week. Crockpots are easy. Cutting up fruits and vegetables are easy. So this does not have to be hard. And I very frequently tell people, men and women, that if you find a gluten-free, dairy-free diet hard or expensive, then you're doing it wrong. It should be easy. It should be relatively inexpensive. You have to buy food anyway. Processed food tends to cost a lot more. However, when food is subsidized, such as wheat, corn, soy, peanuts, those foods tend to be in everything. And unfortunately, at this point in history, our government is actually paying the food manufacturers to include those ingredients. So if you start to read labels, you will see some form of wheat, some form of soy, some form of rice, and a few other ingredients in almost every processed product. Go ahead, check it out. I can almost guarantee that every product that you pick up in the grocery store will have some of those ingredients, even things that you didn't think should have them, like ketchup. Sometimes I find wheat in tuna, believe it or not. There's a lot of sugar in many of the processed products, even things that you wouldn't think there would be sugar in, such as ketchup or mayonnaise, or many of the other products that are on the shelves of the grocery stores. So just pay attention. Be a little bit more aware of what you're eating. And it's much easier if the entire family goes gluten-free. It doesn't make sense to have gluten in a gluten-free house because of the cross-contamination issue. Starch replacements, which are basically sugar replacements, but if that's what you need in your diet, then potatoes and rice are easier than gluten-free pastas. Sweet potatoes and yams are much better than white potatoes nutritionally, and they have a lower glycemic index than white potatoes. But white potatoes every once in a while for most people are going to be fine, unless you have an issue with nightshades. Brown rice is better than white rice nutritionally. So just be aware and make choices based on your preference, but also nutritional value. If you are eating gluten-free bread and bagels and things like that, try eating them less often, but also put them in the freezer so that when you do want one, you have one available. Always think of eating less processed food and more fresh food, especially this time of year. It is much easier to eat fresh food during the summer months and the early fall than it is sometimes in the winter, depending on how much preparation and what goes into your cupboards. So for us, for instance, we have a half a grass-fed, no antibiotic, no hormone side of beef. We also have a half a pig in our freezer. I've put up some blueberries and raspberries and blackberries, strawberries. So we have a lot of foods in our freezer already that will help keep us over the winter. I've also talked to a lot of the men about other issues, that it's embarrassing. They don't want to feel needy or weak. Trust me, I don't either. And I might have been one of those annoying people that was not so kind to people that had to be gluten-free in the past. Certainly when I was much younger, a teenager or in my 20s, even though I had symptoms at the time, and even though I didn't know I had celiac disease, I still had many symptoms. And I guess if I would have known that I had celiac disease at that point, I would like to think that I certainly would have changed my diet without any compunction. However, I do recognize that people don't want to be embarrassed in social situations, that they want to feel normal, whatever that means. And they don't want to call attention to themselves. And this is not just men. Women are the same for the most part. There's always going to be those annoying people that want to make it all about themselves. But for the most part, people don't want to be embarrassed. As I've mentioned before, TV shows use people that are gluten-free as an easy target, which, if it's comedy, we have to put up with that to a certain degree, but it's annoying to see our very serious medical condition actually lambasted on comedy shows. But I do understand. Sometimes I laugh a little bit too. It can be harder to give up gluten and dairy or go on a paleo diet if you actually like fast food or junk food. There are many, many Americans that are on a standard American diet, which is sad, by the way, standard American diet, that makes them fat and unhappy and unhealthy, but they like that food because it is addictive, or it is easier, or they like the convenience, or the fact that they can get 3 hamburgers for $1. But that all comes with a price. And you have to factor that price, the price of your health, into that equation. People have also told me, men especially, that it is difficult at someone else's home that is trying to cook for them or feed them, especially at weddings and social gatherings. And we were just at a wedding this weekend, and some of the food was gluten-free and some of it wasn't. And so we all had to decide whether we were going to trust the fact that the food that was labeled as gluten-free wasn't cross-contaminated. I myself decided that I was going to stick with one thing that was minimally processed or cooked and eat that one thing. And during that wedding, there was a joke about, that gluten-free food was tasteless, and it's been a joke for many years. But I also have to say, you wouldn't say that the diabetic diet or any other diet that people have to be on for a medical reason is tasteless or a fad or a joke. It just wouldn't happen. So I do ask people for a little bit of grace in making sure that, people, especially children or the elderly population, don't become the brunt of your jokes or your animosity. Especially children, they need our support and they need our help in just making sure that we can get safe food. That's basically it. We just need safe food that's not cross-contaminated. And a lot of men have said that gluten's not hard to give up, but it is the sugar and the dairy that is hard to give up. And a lot of people will go for the gluten-containing fast foods or prepared foods to the gluten-free prepared or junk foods. And I will say that a lot of the gluten-free foods are very processed and they're not very nutrient dense. They're actually nutrient deficient. They tend to have a lot of sugar in them and bad fats, things that I wouldn't eat anymore. In the beginning, that's what I did. I replaced all my gluten-containing products with gluten-free products, and I would no longer recommend that people do that. Interestingly, my daughter, who goes to some of the programs with me, has gone to both paleo conferences and gluten-free conferences. And both of these conferences have food. The gluten-free food conferences, she's noted, tend to draw people that look tremendously unhealthy. And I have to agree with her as a nurse. The paleo conferences tend to draw people that are much healthier. They're physically fit. They're not grossly overweight. They are trying to be healthier. Where the people that go to the gluten-free conferences tend to still be overweight. They have funny gaits. Their skin isn't very clear. I'm just thinking of some of the people that I saw at one of the recent conferences, and they just generally overall don't look healthy yet. Again, that's one reason to go to a whole food diet or some variation of a paleo diet, which allows you, by the way, to eat more bacon. If you're considering going on a gluten-free diet or a paleo diet, I would recommend that you investigate the Whole30 diet, which is by Melissa and Dallas Hartwig. It's just a quick, easy 30 days of eating whole foods, cutting out alcohol and sugar, and it allows your body to reboot. We allow our smartphones and our computers to reboot every once in a while. We turn them off and we allow them to reset, and it's a good idea to do that with our bodies. So if you want to look that up, it's called the Whole30, and there is a book and there's a cookbook. And Pete and I have done the Whole30 at least 2 times now, and I think we've done it for half a month. So we've done a whole 15, just again as a quick reboot and to remind ourselves that we need to focus on real food. What are the benefits for men for going on a gluten-free and or paleo diet? Well, all of those nagging GI signs or symptoms clear up. There's no pharmaceuticals, over-the-counter medications, or surgeries involved. It's a diet change only, and people get better. Many of the men that I've talked to over the years have had depression, fatigue, anger issues, addiction issues, gas, bloating, joint pain, muscle pain, facial tics, seizures, many different things go away. And that is what this is all about. It's making sure that our bodies can be as healthy as possible for as long as possible. And I will mention weight loss because some people do lose weight. Some of my patients actually end up gaining weight. I have worked with a number of men who thought it would be healthier for them to be vegan or vegetarian, and they were extremely malnourished. Well, if you're vegan or vegetarian and you're focusing your proteins on seitan or wheat or grains, but you're celiac, the risk is that you're going to end up cachectic or losing weight and having a hard time gaining weight. So some of the men that I've actually worked with that were vegan or vegetarian are now on a paleo diet, and they're much healthier. They're at a healthy weight. They are able to gain muscle mass where before they weren't. Their pain issues have gone away, and they're much happier. We all need to be happier in our lives, and this is just potentially one way to do that. This has been a great topic, and I've really enjoyed covering it because some of the men I work with are so much better, and they're so much happier. It's just a pleasure to see them go from being very sick or getting out of the hospital or struggling with health issues to being happier than they've ever been and healthier for their long-term health. And as an emergency room nurse, I don't want to see people in the emergency department with catastrophic events that could have been prevented. So we all need to look at our diet, at exercise, at sleep, at our general lifestyle. And today, during episode 35, I hope this has reached men from all over the world and will help you decide or stay or adopt a gluten-free or paleo lifestyle for your health and for the long-term health of your family so that you can enjoy your family and your friends for as long as possible. At this point, I'd like to thank Tim Hallowell of The Podcasting Guy for his superior production and editing of the Gluten Free RN podcast. I'd also like to make a huge shout out to Pulse Media Network, my team of healthcare provider professionals that are also podcasters and are very supportive in the Gluten Free RN podcasting world. Additionally, I'd like to thank all of the people worldwide who have been listening to the Gluten Free RN podcast. And for those of you that have left a rating and or a review of the Gluten Free RN podcast on iTunes, Stitcher, Google Player, or wherever you listen to the Gluten Free RN podcast. Thank you. And this has been episode 35, Men and Celiac Disease. Until next episode, eat healthy, be healthy, and have fun. Bye.